Lior, you want to hit the record? Oh, you already did it. Gosh, we're just so on the same wavelength. Okay, guys. So welcome everybody. It's really great to have you with us. My name's Sam Robinson. I'm here on behalf of JReady and the Jewish Agency, together with some of my incredible colleagues. We have Yael Raz, who is the Director of Emergency Response at the Jewish Agency. Give a wave, Yael. We have Lior Sharil, who is the Digital Director of JReady. Give a wave over there. Where are you, Lior? There we go. And we also have our incredible Nitziga, our regional representative and director of the Jewish Agency delegation in Australia, who's responsible for the whole region over there, Orit. Give us a wave, Orit. Hi.
Hi,
great
everyone.
to have you with us. So just to give you guys a bit of background on why this is happening. So JReady is the Jewish Agency's platform for crisis response and building community resilience. Obviously, there's a lot more we can say about that, but in the interest of time, I'll keep it very brief. The main mission of what JReady is doing is really to effectively train Jewish community leaders. That means both professionals and volunteers from such a huge range of backgrounds through various elements of crisis management, while also creating a very, very connected network of global community professionals who are able to assist each other through challenges that they face locally, nationally, and on a global scale. This seminar specifically came as a direct result of one of the seminars, one of the training sessions that we ran with our friends from Australia, from all different kind of community organizations and leadership roles in Australia, together with their partnership of the Arava region in Israel. And these seminars actually came as a direct request from some of the graduates of that program that we ran together with Tel Aviv University. Following this semester-long program that we did of disaster management with the cohort from Australia and the Arava, there was this need expressed for greater training in the field of inclusion and access. So 3 of our participants from that course, Sharon, Dean, and Stacey, who work for incredible organizations in Australia that support people with disabilities, really expressed the need to expand awareness across the board of all Jewish community organizations in relation to access and inclusion, and particularly in times of crisis. JReady as an initiative partners with dozens of organizations throughout the world and hundreds of experts who are really, really phenomenal in so many areas of crisis management and so many different backgrounds dealing with emergencies. And as such, it was a natural choice to bring in our partners from Bet Izzy Shapira to facilitate this specific training seminar. We see a number of our wonderful colleagues from Bet Izzy on the line here. And so we're very, very, very grateful for you and for all of the investment that you put into creating this seminar. I hope that all of you participating in this program really gain a lot from it, find it meaningful, gain practical tools from the experience, and also are able to expand your own professional networks going forward. And that's basically it. So at this point, it gives me great pleasure to hand over to the wonderful Sharon Yechezkel Oron from Bet Izzy Shapira, who will share more about the framework of the upcoming seminars and also introduce our amazing facilitators for the program. So thank you very much. And Sharon, over to you.
Hi, everyone. Good morning, good afternoon, good evening, good night. So my name is Sharon, as Sam mentioned, and I direct the Global Professional Development Department at Bet Izzy Shapira, which essentially means all of our international connections and projects that we do overseas. And we are thrilled to be partnering with JReady and the Jewish Agency to bring about, to talk about this really incredibly important topic, which we've all had to deal with. Israel, we've been dealing with it a lot, with various crisis modes. But the whole world has been dealing with it around COVID, and it's a really, really important topic that's very close to our hearts. So thank you all for joining. So we have a 3-part seminar, right? We have the first session today, we have the next session next week, and then the week after. And we're going to be talking about inclusive crisis preparedness and management. For our first session today, we're going to be talking about inclusive social design. So it's really how do you set the stage right now in order to be more resilient and be able to manage and prepare for crisis. And we have with us 2 incredible professionals. The first is Yoav who is the director of the Social Change Unit at Bet Izzy Shapiro. And we have with us Osnat Lahat, who is the coordinator of our Begin Shapiro's Leadership Center's Health Forum, and the incredible work that this Health Forum has been doing, throughout COVID and even before and the aftermath. So Yoav, I hand it over to you.
Thank you, Sharon. First of all, I would like to apologize. I don't have English as good as Sharon. I hope you all will understand what I'm trying to say. It's always challenging to lecture in English for me. Myself, I have, besides my cerebral palsy, learning difficulties. I can't read or write even in Hebrew, so learning a second language was very, very challenging, and I hope it will be good enough. Okay, when we talk about crises, we need to understand that nothing that we don't have, anything that we don't have in regular days, we will not succeed in building into the crisis. If you don't have methods of how to help people with disabilities doing everyday life good enough, established enough, it will not be, you cannot build it through the crisis. Therefore, we now will talk about what should be the community services for people with disabilities in more calm days in order to be good enough in time of need, in time of crisis. And just for, I don't know which organization here have knowledge about disabilities and which not. So I start by letting you know some of the basic theories in disability, in the disability world now, and in the disability field, and I'm sorry for all the people who already know what I'm going to say, but I just want to be sure that everybody on the same level, or in a level that we all can talk about. So the main thing that we are going through now is a movement from the medical model for disability, who talk about exclusion and special services and trying to repair people with disabilities, into a human rights, the social model for disability, who talk about accessibility and the right to inclusion, and mainly going through the point of view of human rights, and the highest achievement that people, the community of people with disability in the world establishes the Convention for Human Rights for People with Disabilities, the CRPD. I think Israel is sign on it and commit to it, and I hope that every country that represented in this session did the same. If not, one of your goals should be to encourage your countries to sign on this very important commission. And when you going in that direction to human rights and inclusion, the main thing that you have to remember is people with disabilities entitled to be part of decision-making and policy-making about their needs. And you have to understand it's not only a human rights issue, it's a very, very effective tools to know what really people need. You have to respect the knowledge that comes from experience in life, the experience of living with disability, and to understand that people know best what they need. And in order to do so, you really have to establish methods of doing that in everyday life. So you need first to help the community of people with disability to understand that they have the opportunity and they need to take responsibility on their own life, because through the years, under the medical model, we teach people with disabilities that somebody else will decide for them, and somebody else will shape the services as they think it's right. And people with disability don't regularly know how to effectively be part of decision making. So you really have to have a community program in order to teach leadership, in order to teach how to be effective in decision making, and to help people with disability to be free of the oppression that they live under all the years. You do it by invite people with disabilities to talk about their needs without judgment. You're doing it by give them the knowledge of how the decision making in their own life affect others, and they need to negotiate it, and to understand what negotiate is and how to do it good. And after that, understand the shape of the policy system in the country, how the municipality work in every country, and how the national decision making are working in every country, and really help them to have accessible ways to the decision making. And then they will influence the decision making, such as Health Forum and Bed Easy, that Osnat will tell you the example after me, and that really made the services more good. But it's only the first point of dealing with the needs of people with disability in crises. The second one is to really build an accessible community in terms of reduced prejudice against people with disabilities, so their neighbors will be in touch with them. So the community, the wider community, will know that in some house there is a man or woman with disabilities who need help, and will know to check on him in time of crisis. And if you have friends and neighbors who connect with them, who really connect with them, they will be, if they can, if they not get hurt themselves in the event, so they will be in touch. They will send the services to them, and it's very important because some of the issue will really make crisis even more frightening than it already is to be alone, is the feel of loneliness. And if someone know that you're there and know to call you and check what you need and know how to talk to you. Some of the people, for example, people with intellectual disabilities need to use, in order to talk with them, you need to use sometimes simplified language, accessible language. You need someone who know how to talk with them. Neighbors and friends, not learning it professionally, but through the years of connection, they know how to talk with that person. So if we reduce prejudice and build strong enough community strength for that, for disabled people, their neighbors or friends can be really the connection to the services who will deal with the crisis. And the third point would be the services themselves, the government need to really know and where people with disability live. In terms of an earthquake, for example, if you don't know where would be someone who really needs more help than others, he probably would be paying on his life in that terms. And if the municipalities will know that in that address live people, men or women with disabilities, a family that one of their members is with disability, and they will know to reach out for them in time of crisis, and know that they need to get there first, or really quickly. It would be very, very good, and it's really easy to do it without invading people's privacy, because you can really ask from the people themselves. If you want help in time of crisis, please register yourself. And then people who don't want the government will know, or the municipality will know, they will not register. But most people who really want help in time of crisis would register themselves, and somebody will have a hold of this notes of how many people and where they live and what are their needs. As they said, as they registered, it would be very, very effective. We tried it in an area of rocket that got rocket very a lot of times, and the fact that the municipality knows they're there and know how to reach out for them, it's a very effective, and most of the people really use it. And some of them didn't want to register, and they know and understand the price that they are paying for not be registered. And as I said, it's not always a big price, because if we're going back to the resilience of the communities and the fact that you build a connection between a person and his neighbors, so these two together can really cover most of the people with disabilities in crisis. The first point I want to make, it's people who really don't know how they will react in a time of crisis, because it's not physically or intellectually disabilities, it's mental disabilities, coping with mental health problem, and some of them can go in different type of crisis to different type of shape of the situation. Some of them can be really, really frightened, and some of them can be really, really active, and you don't really know how. They don't know until they are in the event how they will react and how it will affect them, and therefore you need that the health servant will get trained by a psychological professional and people with mental disabilities on how they want to be asked about the help that they need in time of crisis. And you need that every one of the rescue services will know the basic thing of how to deal with possible health disability crisis. If someone go into deeper feel of frightening or become very active, to know how to deal with it. And it could be done, and it's done. It could be done, and it's done beautifully in some areas in Israel. Not enough. We still have a really big, a really long way to go. But we know from the start, from the pilots that we made, that it can be really a good solution. And it would be a good solution for others as well, because most of us, if we're going through a really bad experience, we'll react psychologically, and we don't know how we will react. With people that we know that they are have mental health challenges, we know that we need to prepare for it. But with others, they can get into a very, very emotional crisis through that event. And if all of the rescuers have the basic training on how to deal with it, it would be better, not only for disabled people, but for everyone. So this is really the fourth point that I really wanted to make, and I will go to Asnat that will give you, she will probably say a lot of clever remark, but she also will tell the example of how the Forum of Health Policy in Beit Easy influenced the policy during the COVID. It's regard to the first point that I talked about. Osnat?
Yoav, thank you. Oopsie. Oh, wait. Okay. Hi. Yoav, thank you very much. Hi, ladies and gentlemen. First, I'll apologize, same as Yoav, because Hebrew is also not my native language. So I made a presentation in order for me to know what I'm going to talk about. And I'm going to speak, partly I'm going to read the presentation, partly read a summary which I made, a very long summary, and partly I'm going to speak by heart, so please be patient. And talking about people with disabilities and making a policy change is a lifetime ongoing process. And we're going to talk about the example which was given to us by the corona pandemic. Yay. There were some positive aspects about the corona pandemic. One of them is that some people survived like us. So can I share my presentation? Let's try.
Yes.
Okay, so just a moment. Wait a minute. Oh, okay. I don't think I will be able to see you while I'm sharing the presentation because of the Zoom limits and the fact that I'm confined to my bed and I'm using my very, very tiny laptop. So if anyone wants to comment or ask a question, just go ahead and do it. Etc. Okay, I'm talking in Hebrew now. Okay, so let's share the presentation. Here it is. So, you can see the logo of the forum that I'm coordinating, Leaders for the Health of People with Disabilities Forum within Beit Izi Shapira, of course, the logo of Beit Izi Shapiro. And I'm going to talk about, of course, inclusive social design within crisis preparedness and management. And I'm going to talk about the role of people with disabilities, actually the role of leaders, people with disabilities who are leaders, because not every person is determined to be a social change leader or is able to do that. So let's talk a bit about the forum. Maybe I'll present myself first, so you'll know who's talking to you. Yes, right? Sam says yes. Okay, so I of course live in Israel. I'm 48 years old. I'm a certificated accessibility instructor, and I work in Shiva Hospital as a sexual consultant for women with disabilities, among many other aspects of my life. And I'm also I also use a motorized wheelchair due to paralysis. This is for the dramatic effect. And the Health Forum was established about 14 years ago, which means that I'm getting older and wiser, let's hope. And it strives to encourage independence and quality of life of people with disability by advocacy, policy making, and legislation concerning the health of people with disabilities in Israel. Okay. Now, in the forum, we have 18 leaders, men and women from all around Israel, from all kinds of disabilities. Well, most of the disabilities, hearing impairment, sight impairment, mobility impairment, as I am, learning impairment, mental or psychiatrist impairment, okay? And most of them still work. I mean, most of us are professionals. We have a lawyer, therapist, veterinarian, pharmacists, clinicians, most of us are still having a professional career, and by we volunteer in the health forum. And apart from the participants who are also already pensioners, and most of us are also active in other organizations as well, which means that we have lots of experience, both from our professional careers and social change activities, and from our own personal experiences. And one of the main points of the ideology of the social change movement of people with disabilities, like the feminist movement, is that the personal is political. What happens within our private life is a political issue, because all of us struggle from structural and social barriers as people with disabilities. Okay? So this was about the forum. Any question? Not yet. Okay. So why was the forum created? I don't know if you know or not, but people with disabilities are at higher risk for chronic diseases than the general population. I'm not talking about diseases due to their disability. I'm talking about regular chronic diseases like gaining weight, or heart diseases, or osteoporosis. Okay, and there are many reasons. First of all, and mainly because of these barriers, that inaccessible health services and buildings. Let's take an example. My example. I told you that I use a motorized wheelchair. And there are many clinics to which I cannot enter because there is one step, because the door is not as wide as it should be, because the bed is too high, so I cannot transfer myself from the wheelchair to the bed. And this is only the structural problem. What about health professionals who don't treat me as mistreat me, or don't have enough knowledge to give me the right treatment that I need, or talk to my caregiver and don't talk to me because they don't think that I can that I know what my needs are, or that I even can speak. Okay, so this is the first main problem. Secondly, stigma and prejudice, especially for people with mental disabilities or psychiatrist disabilities, but not only them. I also enjoy this situation. Enjoy, I'm cynical, right? Stigma and prejudice means that sometimes certain people are overlooked when priorities are made, like in the government. Okay, no wonder, even though we have legislation, buildings and health services are not accessible yet. This is because of stigma and prejudice, and the fact that they think that people with disabilities don't really count. Okay. Third reason, focus of the disability on not their well-being in general or their medical complaint, like people with psychiatrist disabilities arrive at the doctor, say, my leg hurts, and the doctor says, no, it's only because you imagine it. It's only because it's part of a psychiatrist problem. Or when I go to the doctor and I complain that something hurts, and he says, well, it's not so important because you cannot walk anyway, or they don't believe me, okay? Or something they think it's because of my paralysis, and not because of other medical problems, and this is really might cause severe problems with people not diagnosed correctly or too late. Inaccessible well-being programs and services. Part of being healthy is maintaining a healthy life routine. And most of the programs are not accessible for people with disabilities. Some local authorities have walking groups on the seaside. Is a seaside accessible? Is a guide adapting himself or herself to people with hearing problems or mental problems who need the language to be simplified? Not so sure. Mostly not. Okay. Financial barriers. It is known that most of people with disabilities are poorer than the common community because of social barriers, and this is one of the greatest barriers in order to maintain a healthy life. Even though in Israel we have a social health insurance. Pharmaceutical side effects, especially with people taking lots of medication. This is one of the problems. And of course, sometimes, yes, sometimes people with disabilities have health problems due to their impairment or health problems. It also happens, okay? We don't live forever. So you understand, these are only certain reasons why people with disabilities are at higher risk for chronic diseases. And this is why creating such a forum such as ours was so important. Furthermore, as I told you, the priorities are not created due to the exact needs, specific needs of people with disabilities. Hence, we need to be involved in decision making. Okay, so the forum was established 14 years ago. I facilitated for about 12 years. And let's talk about what we did before the corona, and then how the corona affected our activities. And the corona pandemic affected our activities excessively. I think I saw. I got. Oh, wait. Okay, so this is how we work today after the corona pandemic. And as I told you, we were effective. The corona pandemic affected us vastly, and I'll talk about the difference between before the corona pandemic and after the corona pandemic. Okay, so today we have two main frameworks. We have a general assembly, meetings through Zoom mainly, once every 3 weeks, and we have 12 task teams. Each task team dedicated to a specific mission, such as a conference, a specific regulation, PR, and such. And the task teams meet every 2 or 3 days. Okay, so we have an ongoing process through the task teams, and once every 3 weeks we have a general assembly, and we use a Zoom application in order to meet, as we meet today through the conference, okay, this webinar. We promote regulation and legislation to ensure access to medical treatments and well-being programs for people with disabilities. We're strategic partners of the Ministry of Health and the Commission of Equal Rights of People with Disabilities. I don't remember if you have talked about that, so I'll stretch it again. We have an equal rights law. It was legislated in 1998. You have talked about the UN Convention for the Rights of People with Disabilities. And after the law was legislated, a Commission of Equal Rights of People with Disabilities was established within the Ministry of Law in Israel. And it is supposed to lead the process of legislations and rights for people with disabilities in Israel. We are collaborating. Okay, this is another strategy. We are also collaborating with MHOs and social change organizations in Israel. In Israel, there are 4 HMOs. We have the National Health Security, and in order to get the health services you need, you're supposed to choose one of the HMOs, and you gain your services, health services, through this HMO. Okay, so we have 4 HMO, and of course hospitals and such. And another strategy was conferences and webinars, and I'll talk about one example. Okay. And any questions? Am I talking too fast? Am I clear? Are you alive? Okay, Sam is here giving me a thumb up. Okay, so.
You're wonderful.
Thank you. Yeah. Okay, so how did we work during those, I think, 10 years or 11 years before the Corona pandemic? Remember, there were times before the Corona pandemic? Okay, so first of all, we had that we actually used to meet face to face. Unbelievably, but every 6 weeks we met face to face, considering the fact that our members live all around Israel. You can understand that how much effort was made in order to organize these meetings, and how much effort they need to make in order to arrive to these meetings. And some of us don't drive. Some of us need to use public transportation, which is not the most accessible way to arrive anywhere in Israel. Okay. So we used to meet every 6 weeks, face to face, rarely in between. We developed a tight cooperation with the Ministry of Health, especially with Advocate Yehuda Meron, who is a legal consultant and advisor of the Ministry of Health. And they still used to consult with us as a focus group, because we have representatives of all disabilities. Understand, we have established a 12 years connection with the Ministry of Health, especially regarding writing of accessibility regulations. As I told you, we have the cooperation with the Equal Rights Commission of persons with disabilities within the Ministry of Law. And accessibility coordinators of the HMOs consulted us excessively regularly in order to enhance.
You can say the word in Hebrew, we'll help you.
Okay, to enhance accessibility of the HMOs. And we created personal and working relationships between forum members. And maybe you don't know, but because the community of people with disabilities is so various, the disabilities are very different from each other. People are from different ethnic backgrounds, economic backgrounds, etc. We needed to understand each other's needs and challenges. First of all, in order to maintain these meetings. Okay. Nevertheless, talking about enhancing accessibility of the health system for people with various disabilities. Hence, the process was very profound and fascinating throughout the years in order to know each other and to know how to work together. And every year, we maintained a conference dealing with issues, all the issues that we dealt with throughout the years, with HMOs representatives, health organizations, ministry representatives, and such. This was all before the corona, okay? Before the corona pandemic. About a month before the corona pandemic, we joined Beit Ivi Shapiro. And then the corona pandemic occurred. And suddenly, we couldn't meet each other. We stayed at home. We were frightened of catching this unknown disease. We had to deal with uncertainties. All the country was in a very strange state, and in this unbelievable situation, we gathered together and we started working through Zoom in order to face the new reality. So, as I told you, the forum was established at 2007, and during the years until the corona pandemic, we structured a very established work infrastructure that we could base on during the corona pandemic. Okay? And what were the contributions of the forum's work infrastructure during the corona pandemic? First of all, even though we were all everyone were so frightened and locked at the home, within the forum, there were strong enough relationships between people with different disabilities that enabled us to respond immediately and act despite the unknown situation in the country and the overall feeling of uncertainty. Secondly, we understood the needs of people with all types of disabilities, because within the forum, we have representatives of most disabilities. And because we live the situation ourselves, we experience the situation ourselves. So we established an emergency line to address individual issues and to locate latitude issues. And I'll talk about it furthermore in a few moments, okay? The constant collaboration with Advocate Yuda Meron from the Health Ministry helped us when we needed to make the corona hotels accessible. And we'll talk about it furthermore. The fact that we knew how the mechanisms work helped us to properly contact HMOs regarding the accessibility of the corona test units. And I'm going to talk about that furthermore now. Okay, thanks to our increasing prestige and esteem, which was created during those 12 years before the corona pandemic, we were invited to participate in the round table of the Prime Minister's office on the subject of corona and people with disabilities, which was an honor, and it was intriguing to meet with other organizations, representatives and ministerial government representatives. We have discovered Well,
not it was honor, but also a big responsibility.
yes, right. And I'm going to talk about that. And Yoav, it was great that you told that, because you stressed that, because we found out, surprisingly, that we are the only forum in Israel which focuses on promoting health policies for people with disabilities. As I say in Spider-Man, with great force has great responsibility, right? So if we are the only forum dealing with promoting health policies for people with disabilities, and we were asked to write recommendations regarding the health of people at risk, and especially people with disabilities, when we handed the recommendations to the government ministries, we had great responsibility, because we needed to think of all populations, all people with disabilities. So now I'm going to read from my what is a summary. I want to talk about 4 examples of activities during the corona. Okay, the first example shows the strength of the inner connections within or between the members of the forum. Second one is the fact, second, third, and fourth, the connections that we made before the corona pandemic, which enabled us to make a change during the corona pandemic. Now I'm going to read. Okay. So, examples. Top, an emergency hotline. During the corona pandemic, we found that the procedures and guidelines issued by the Ministry of Health, not only the Ministry of Health, were focused on the elderly population and did not meet the needs of people with disabilities. Not only that, but people with multiple disabilities were afraid to leave their home and use medical services because they would be turned down, even though they were considered complex. They were not necessarily defined as risk group by the medical staff. Remember, especially as, when we needed to take the vaccine, it was the main issue. People who had disabilities, complex disabilities, and were not considered a risk group. Therefore, we established an emergency hotline to which people with disabilities could turn to when they found it difficult to comply with the guidelines issued to the general public. And by the way, we could establish the hotline with the great help of Betty Shapiro. So these people with disabilities approach this hotline either when they couldn't comply with the guidelines, or when they needed medical attention and were afraid to use the system or were turned down. Right? Furthermore, we established task teams working in parallel in order to overcome the many tasks and dilemmas we encountered during the corona pandemic. As I said before the pandemic, the corona pandemic, we used to meet every 6 weeks, face to face. But through the Zoom application, and because there were so many tasks and urgent tasks due to the corona pandemic, we started establishing task teams, and which made our work more professional and enabled us to react quickly to any request that we received. Guidelines. Since the onset of the corona pandemic, the forum collaborated with establishments officials to create guidelines that take into consideration the needs of people with disabilities who were infected by COVID-19 or have been exposed to a verified carrier and needed to stay in isolation at home or in a designated hotel or hospital. In Israel, the government decided that people who are exposed to a verified carrier or are infected by corona and do not need to be hospitalized have to stay in designated hotels. One problem was that these hotels weren't always accessible, and the guidelines were not considering that, some of the guidelines. Okay, so the first published guidelines regarding these corona hotels required people to stay in the hotel room they were assigned to for the entire isolation period without leaving. They were also required to change their own bedding and eat alone in the room the food that the staff placed for them on the doorstep, informing them that the food has been served. Now, let's think of a person with a wheelchair, using a wheelchair, who needs to take the tray from the floor. A problem, right? Or a person with a hearing impairment who needs to hear. The staff member telling him or her that the food was placed near the door. A bit of a problem. A person with a psychiatric impairment or and which needs to be confined to a room for an unknown period of time. A bit of a problem. A man or a woman who has paralysis and cannot change their own bedding. A bit of a problem, right? So we, as a multi-disability and diverse forum, expressed our concern about the ability of people with disabilities to cope with these guidelines. Okay? What about people needing assistance, who cannot stay alone? People with vision impairment who have difficulty navigating in a room where they're not familiar with, such as a hotel room. So people who find it difficult to adjust. So we approached Advocate Yehuda Meron. We talked to him. He's a consultant of the Ministry of Health. And we talked about him, about we discussed the effect of the consequences of having to stay in a hotel for the isolation period. Think about possible solutions for isolation away from home. Following this consultation with Yehuda Meron, a new guideline, we were so proud, really, we were so proud. A new guideline was adopted, the Ministry of Health wrote a new guideline which adapted the needs of people with disabilities who are assigned to, and the adapted guidelines took into consideration most of our recommendations. For example, being attentive to the needs of persons with disability before arriving at the location, and having a plan of action ready for when they arrive. Think of a blind person having who is obliged to go to such a hotel. If you explain to him or her how the room looks, where is the bed, when is going to, or how is going to get the food, where is the bedding, I mean the bed sheets and such, this person can stay in the hotel and not suffer as much. Okay. So I must stress that the current adapted guidelines is not the end of the process. I mean, we still have to study from the experience of people staying in the hostels and improve the future solutions. Furthermore, we don't think that being in a hotel is the best solution for people with disabilities. I mean, solutions should be also found for people who must stay at home or at a higher risk to get infected. We believe that the best solution is isolation at home with the support of their HMOs, depending on the case, of course. Hence, our collaboration with the HMOs is very important. And talking about the collaboration with the HMOs, I have another example, mobile corona test units. We found out some of the HMOs built mobile corona test units, which were not accessible for people with disabilities. So we wrote letters to the HMOs demanding to rebuild the mobile corona test units so they would accommodate the needs of people with all kinds of disabilities. Happily, our request was granted and the mobile corona test units were changed and became more accessible. I'll show you show you a picture. Okay. Do you see? These are the, on the left-hand side, you can see an inaccessible unit. Okay. Someone in a wheelchair cannot approach the laboratory. The HMO work staff is working, standing there with holding his hands forward. If you will sit in a wheelchair, you cannot approach this person. Okay. But if you can see the lower unit, okay, the lower picture, you can see that person with a wheelchair can access the unit. Okay, so this was the difference afterwards. Now, during the corona pandemic, many health services started using digital health systems, like video conferences with doctors. Okay, now this technology can gap accessibility barriers, but at the same time, it creates accessibility barriers. Hence, we conducted a Zoom conference, which has 3 parts. I think that about 300 people participated in this 3-part convention. We had attendees from the Ministry of Health, Health Services Accessibility Coordinators, the Commission for Equal Rights of People with Disabilities, and of course, a community of people with disabilities, because nothing about us without us. We talked about these topics: accessibility of health services, digital aids, home health care appliances and services, which are not accessible, sadly, and web-based services. We had many conclusions. First, many of the services and appliances are not accessible for people with various disabilities. They might be accessible for some of the people with disabilities, but not for all of them. The regulator must regulate and standardize the accessibility of digital aids as fast as possible and with the involvement of people with disabilities. I hope that if you remember one conclusion from this webinar, from this lecture today, is that the participation of people with disabilities during the process of making decisions, understanding the problems, and finding the solutions is not a burden. It's a wonderful and very useful way in order for the mapping to be accurate and the solutions to be also as accurate and to accommodate the needs of all people, not only people with disabilities, all the community. Okay? Another solution was that digital development will always be faster than regulation. So we cannot only rely on regulation. We also need to make social change among the people who develop digital solutions and any other solution or a process in our society. Other conclusions: we need to formate sufficient training mechanisms that for all involved in developing digital services. And as this webinar today, if we want to approach the next crisis and prepare services for people with disabilities, which will accommodate their needs during crisis, and of course, during everyday life, we need to train people. This is not something which happens one day like magic. It doesn't. We need to think ahead. Okay, and as I said before, we need to involve people with various disabilities in the earliest stages of development of services, in every kind of process. And talking about crisis, it's even more important. Okay, and this is a picture. I wanted to show you one of our activities. Here we participated in a parliament committee. By the way, last week, a member of the forum and I participated in a parliament committee regarding legislation about health services for people with disabilities during crisis situations. Okay, hence, as I said, and I'm going to stress this during the conclusions, this is an ongoing process. We need always to rely on the past, learn from the past, and think ahead about the future. Okay. We arrived at the conclusions. Oh, so quickly. Okay. So, okay, wait a minute. I'll read from my paper because I elaborated more. So, first thing, conclusions. Nothing can be created without building a base. You cannot approach a crisis if you don't have regular day life processes and the infrastructure. Hence, infrastructure needs to be built on a routine basis so that it can operate effectively in times of emergency and crisis. Had the forum not been working so efficiently during these years before the corona pandemic, it couldn't have reacted so effectively during the corona pandemic. And furthermore, the capabilities of knowledge of the forum, by and by with the vast and strong collaborations made enabled us to connect with the key holders. All these cannot be established in an instance, especially when one needs to address complex issues and dilemmas. Second conclusion, it takes a considerable time and effort to create work skills and trust relationships, both within the forum internally and in collaboration with key holders outside the forum, such as government ministries or accessibility coordinators, HMOs. Because it takes time and lots of efforts, we need to start working today. Yes, yesterday we need to start working today in order to make the facilities which will enable us to approach the crisis considerably well. Building trust relationships within the forum, as I told you, the forum members are from all kinds of disabilities. As building trust relationships within the forum is essential to express the needs of people with various disabilities and not to be preoccupied only with one's own needs during the crisis. And as I said, technology can gap accessibility barriers, but can also create accessibility barriers. Hence, we should also always consult with people with disabilities, developing technology and using technology. And as I said before, this is an ongoing process. Even today, we bear the fruits of the insights, connections, and tactical mechanisms which we created and developed during the corona pandemic, such as the webinar in which we participate today. In conclusion, cooperating within the forum with diverse, cooperating within the forum with a diverse group of people and cooperating with key players outside the forums, such as the decision makers in the Ministry of Health and accessibility coordinators in health institutions, is a founding principle that will help us achieve our goal, a sustainable quality of life for people with disabilities and general population in Israel and in the world. The corona pandemic poses many challenges for decision makers in the establishment, with service providers and service consumers. The challenge is even greater in the field of health, and in particular with the people with disabilities who battle with barriers on a daily basis, let alone in a pandemic or other crisis. At the same time, this is a period of great opportunities to realize and to put to test our collaborative infrastructure. It's been there before the pandemic, but the urgency and the need for quick and safe solutions only proved that the system works. When we have the right infrastructure, the system works. We know now more than ever that knowledge should be open source and shared continuously so that the corona pandemic or any other crisis will help us develop a solid infrastructure for dealing with more crises to come. Hence our webinar today. Thank you.
Before we open, thank you, Osnat, it was wonderful. Before we open for questions from you, I wanted just to add that we can do another webinar on how to develop leadership, that doing the good work that the health forum did, but you must to have this mechanism in order to help people with disabilities in the decision-making process effectively, and to help people with disability and others, minorities as well, to be free of the oppression and the exclusion that they experience. It's a really professional process that you need to learn and to establish in every country. So we are prepared to do webinar on this process also.
Yes, and we have also one dilemma which I want to share with you. I'm talking about the dilemma which the forum deals with. Who don't we represent? Because even though we're people with disabilities, but we are actually quite privileged with people working. We're able to be activists. What about all the people who are not active? Or what about all the people that we who cannot participate in such forums or in such leadership groups? How can we approach their needs in order to attend their needs in everyday basis, let alone a crisis situation? This is a very important situation, a very important dilemma. So on one hand, we need to help people develop people with disabilities develop their leadership skills. On the other hand, we also need to approach those people who cannot or have too many barriers in order to participate in those groups.
Thank you. So we want to open for questions. Yeah, Elle, I see you already have a question. Go for it.
Yes. Hi. My name is Yael, and I work at the Jewish Agency. I'm a disabled person, and I really appreciate learning how, first of all, I was not aware of this forum, and I was helped by a number of various organizations in the community in order to bridge my return to work after chronic illness. I have multiple sclerosis, and I was out of the workforce for almost 10 years. And so bridging my way back into the workforce was a very long process and a very complicated process. I also happen to have a PhD in social work, so I'm very familiar with the social welfare system in this country. And I have to say that, first of all, very much huge toda rabba v'ha'aracha gdola to both you, Osnat, and to you, Yoav, for your presentation. Just really want to express my gratitude. And I want to also relate to the last point that you were talking about, Osnat, in the conversation about working with disability, people who have disabilities who are in the community, who are not in this point of privilege, because like all communities, the disability community is very diverse, and it has a huge amount of diversity, and there are many people who don't have access even to the things that are accessible because of all kinds of different barriers, even geographic barriers. I live in Jerusalem. I have a huge accessibility to many services and places that many people living in the geographic periphery don't have accessibility to. So one thing that I wanted to just mention is that during the corona pandemic, I was isolated for a very long time, unfortunately, for 11 months. Didn't have any contact with anybody. I have a lot of risk factors, and I just really was in my house. But I have to say that the local social services network, so social welfare services, social workers, various organizations, even the community centers in my neighborhood, the local community centers, the matnasim, they all worked with Pikud Oref, I don't know how to say that in English, the home front command, I think it's called, of the military. They worked about making sure that there were certain people like me who they knew were on the list. They knew where we lived. They would come with food packages. They figured out what our needs were. I couldn't have my helpers with me at that time. So, certain things, again, Yoav, you spoke about personal responsibility of disabled people during a crisis. So that was something that I actually remember as an experience that empowered me, made me feel very strong, was that I couldn't do things like, I dropped about, during 11 months, probably 6 or 7 pieces of glasses or plates, and things broke all over the floor. And all I could do really was just to push all the risisim to the side and just push everything to the side. And I didn't have anybody to help me with my bedding for 11 months. So I just put a towel or, I tried to figure out what I could do. Of course, it was not fun, but at the same time, I felt it built my resilience. It built me as a person. I tried to look at it from that point of view. I also certainly used a lot of help in digital supports. Got some mental health counseling during that time because it was very frightening what I was going through. So through my HMO, I was able to get a referral to get some counseling. So there were services that were available, but again, because of my privilege and my awareness of needs, and also my experience as a professional social worker for 35 years, I understood how to try and navigate the services for myself, but I was always thinking, as you both mentioned, about the larger community. So I think that one of the things that could be potentially very helpful is to collect some of these post-pandemic stories about people with disabilities and pinpoint specifically what those topics were that came up, because as you mentioned, people with different disabilities don't know how they're going to react in a crisis until the crisis hits. You sort of have to experience it in order to move forward. So that is something that I would certainly suggest, and I would be happy to volunteer to share my story, to write it. Other people, I'm a professional writer. That's what I do at the Sukhnut, at the Jewish Agency. So I could help other people to write their stories, pinpointing where the intersections were with their needs and services that either were available or weren't available. And that might be a way of mapping out, more to learn about how people handled this situation during the corona. So I really thank you very much for your presentation. I'm looking forward to the next 2 weeks.
Yeah. First of all, I want to thank you about your offer, and we will talk. And the other thing, I want to use your example to emphasize that you can take the example of the health forum for any other areas of life. I mean, you talked about how after you get your disability, you couldn't find your way back into the work market, and if we will have forum that work like that and learn as well as the health forum learn the issues of working in the free market and be included in a diverse workplaces, it can be this. It can do the same for the work market as we did at the health issues. It takes time, and you need to be professional enough as a social worker. I'm sure you know that you need to be accurate enough and deep enough in learning the problems and the solutions.
Yes.
And this is the method. The health forum is only an example of how you can really go through challenges through leadership of people, through effective leadership of people with disability who really address profoundly a subject, and therefore it's an answer for personal crisis such as what you experience, and national crises like we talk about today, and to establish it, it's a commitment. It's a commitment that we need to take as a community to really be committed to hear all the voices and to give all the minorities, including people with disabilities, the chance to raise their voice up.
Yes, and I would like to say first, thank you for your for really revealing your life, personal life. Stories are the greatest tool.
I think so.
We can always talk about theories and facts and statistics, numbers and such. But when someone tells here our own personal story, genuine story about dealing with the situation, this is the strongest tool. That's why we need to gather stories. Furthermore, a health story shows us that even when you're well connected, you still have to encounter as a woman with disability, but I suppose that other minorities also, with terrible situations such as not being able to make your own bed or being so alone during these 11 months. And I want to say two things about that. First, I didn't say that, but while Yael was talking, I thought about that one of the strengths of the forum during the corona pandemic was the fact that we had group meetings, we could meet, we had a purpose during this terrible time. I mean, working together was actually one of the forces that enabled us to work together. Because I had a community during this time. I wasn't alone. I was confined to my bed during this past 12 months due to pressure sores, and having a Zoom meetings, and a community of people working immediately every week is what enabled me not to be discouraged during these many months, let alone, of course, a world pandemic. And second point that I wanted to stress, a few months ago, we met with a few members of American disability organizations. And the stories were, even though Israel and the US are so different, especially the health systems, the stories were so alike. So not only gather are the stories in Australia or in Israel, gather stories from all around the world and find out what are the gaps and the barriers and also the solutions, which are similar all over the world, because then we can make a real change, real difference. That is why it is so important that you arrived here today, and I hope you'll participate in the next two webinars and listen and learn, because many of the barriers, even though the world is so wide and diverse, many of the problems that people with disabilities encounter are so similar, especially prejudice and inaccessibility.
Yes.
And of course, the ability of people to lead social change, okay? To build a community and to lead it. This is a worldwide present, I think.
Do we have time for just one more question from Meira? Go ahead,
Thank
Meira.
you. I have a question for Osnat. First of all, Yoav and Osnat, thank you both for your presentation. It's very informative and also inspiring. I wanted to ask, you mentioned that you have 12 different task forces or task teams, sorry. How many adults with disabilities are members of these task teams? And do your task teams also include family members or parents of younger children with disabilities?
Okay, so unbelievable, but we have 18 participants in the phone, and they are the members of the task teams, which means that many of the members,
18 or 80?
18 members. They're all adults. Some of them are also, besides being people with disabilities, are parents of children with disabilities. The forum changed during the years. We didn't have many participants. What we had, few participants were not people with disabilities, were parents, people with disabilities, children with disabilities. This is a discussion that we maintain in the forum. As I said before, who do we present and who do we not present in the forum? And especially as we know that some issues we don't deal with because we don't have representatives. And on the other hand, 18 people, especially in the assembly meetings, there are many people and they are very opinionated, especially because we're Israelis. So having a bigger group might be a bit of a problem. Don't you know the saying that if there are two Jewish people, there are you have three opinions. But although the task force are only maintaining the members of the forum, we always consult. We always meet with professionals and other members of the community and representatives from the government. We keep on consulting. We have collaboration with other organizations dealing with people with disabilities. We now have created a coalition of 7 organizations of people with disabilities or people with health, chronic health problems, in order to help create a new role, profession of health coordinators in this organization. So we keep on the good work. But the 12 task force task teams are, yeah, we're very busy. If you want to help, come on, we need your help.
Absolutely brilliant. Okay, we've come to the end of our time. I want to say a huge thanks to Yoav and to Osnat, and also to, of course, Sharon and Michael from Bet Izzy for helping coordinate these sessions. I think you'll agree with me, it's incredibly empowering to learn from you guys, from Osnat and from Yoav, from your experience and your expertise. And I think that all of us are here because we deeply care about and are concerned about the arena of access and of pushing through legislation, ensuring equal opportunities and all of the above. But there's really no one better to educate us and to educate others than those who live and breathe it every day in these challenges. And here we have unparalleled expertise from Bet Izzy Shapiro, and we're very grateful. What you guys do is remarkable. We're really appreciative of this partnership with the Jewish Agency, and that you're taking the time to educate and train community leaders from around the world. So thank you so much for being here with us. To all of you, thank you for joining. I really encourage that you share the word about these seminars with others from your organizations and from wider community. Encourage other professionals to join the upcoming sessions. We have one next week on the 24th at the same time, and the following week on the 31st. The one on the 31st will be a very interactive kind of workshop, and the one next week will be another kind of lecture session sharing further details and trainings in this arena. It's really super critical that we share this knowledge with a vast and wide audience, even beyond those who deal directly with people with disabilities. So please share this information with others, colleagues, friends, and other professionals around. So thank you very much, guys. Thanks for being with us. Have a wonderful rest of your day / evening, wherever you are in the world. And we'll see you next time. Take care.